Now, from your local source, TV 20 News, 5:30 live in high definition.
Welcome back. Doctors appear to be getting a handle on at least one type of cancer. Cervical cancer deaths have decreased by an astounding 74% in the U.S. in the past 50 years. But that's not the case in the third world, which has 80% of the world's cases of cervical cancer. Doctors say the difference is the pap smear screening test. It's not a simple test to administer until now, and that's the focus of tonight's Technology Spotlight. David?
Well, thank you, Paige. Here with us tonight is Dr. Steve Hsu, an associate professor of medicine at the UF College of Medicine. Thank you for being here this evening.
Thank you for the invitation.
Tell me how complicated is the pap smear, the traditional test, to administer and analyze?
Yeah, I think most people have the sense that it's actually a very simple procedure, but it requires a trained physician to do the speculum exam, actually obtain the sample, smear it on a slide, and then it has to be interpreted, not just by any pathologist, but by a highly trained cytopathologist.
Somebody who can understand what it actually means. Well,
right.
What have you developed to make it easier to administer and diagnose the test?
Well, I think that there's been a public health care model that has been articulated for how to combat what was previously said, that the majority of cervical cancer mortality and incidence is actually in developing countries and areas with low resource where screening doesn't take place. And screening, so the model is really to screen and then be able to treat and then prevent in an affordable manner, in a very reasonable public health care kind of model. Problem is, to do that, you have to almost eliminate physicians from the process. So the screening part, they're starting to get a handle on. They have a number of very simple and inexpensive ways of essentially swabbing the outside of the cervix of a woman and seeing if it turns white, that there's a lesion there. The problem is what to do next. And that's where we've been focusing our efforts, because if you are able to detect it, you need an affordable and hopefully non-invasive and efficacious therapy. And the problem is, in developed countries, we've always used sort of very invasive methods, using liquid nitrogen to freeze it off or to do a complete biopsy of that area. And so obviously, if you think about a village in sub-Saharan Africa,
not going to work.
It's not going to work. And so that's been the stumbling block, is that we have articulated this model, and that should work, but the problem is the therapeutic arm for the screen, treat, prevent model, in my mind, hasn't really been developed yet.
And are you working on something as it goes? Okay, we've identified, okay, we've done the test, and so we know that someone has cervical cancer. How do you treat it?
Right. So my idea is, it seems very simplistic in a way, is to actually use a topical application. So it has a few challenges. Number one, if you're going to work in the developing countries, in low resource settings, in extremes of temperature, no running water, no electricity, very small workspace, no trained personnel, you want something that can be applied actually by the patient herself, self-application. So my idea is really to create a biopolymer formulation that actually has drug in it for the chemotherapy, and sort of put it in what would be very similar to a contraceptive diaphragm that a woman can insert herself. And the idea is to have a single dose, because in these settings, it's hard enough already to get a woman to come in just for the screening.
Yes, so one visit to the doctor is difficult enough.
That's right.
I'm afraid it's a complicated subject, but evidently making great strides forward. Congratulations on that. Also one of the semifinalists for the CADE Prize this year, Dr. Steve Hsu. Thank you for joining us.